You have probably been told that erectile dysfunction after 60 is just part of aging, that your blood vessels are worn out, that your hormones are depleted, that the little blue pill is your only real option. But what if I told you that a plant, one plant that grows in the mountains of Peru, has been shown in clinical trials to work as well as prescription medication, without the headache, without the facial flushing, without the dangerous drop in blood pressure that sends some men to the emergency room? I am not here to sell you anything. I am here to show you the research. A 2024 meta-analysis of 11 randomized controlled trials involving over 600 men with erectile dysfunction found that this herb significantly improved erection hardness scores and sexual satisfaction compared to placebo. In head-to-head trials, it matched the leading prescription drug on effectiveness, but with a fraction of the side effects. And here is what your doctor probably will not tell you. The mechanism of this herb is not just about forcing blood vessels to dilate like the pill does. It works on 3 separate pathways simultaneously. It relaxes blood vessels, it boosts testosterone naturally, and it reduces the inflammation that clogs the very arteries that supply the penis. One herb, 3 mechanisms, no prescription, no shame. No trip to the pharmacy counter where the teenager behind the register knows exactly what you are picking up. Before we dive in, a quick note. I am a physician, but I am not your physician. This information is for educational purposes. Do not stop any medication without talking to your doctor. And if you have heart disease, if you take nitrates for chest pain, you must not combine this herb with those medications without medical supervision. The combination can drop your blood pressure dangerously low. I will say that again later because it matters that much. The herb is called Maca, Lepidium meyenii, a root vegetable that grows in the high Andes of Peru at altitudes above 13,000 feet. It has been used for over 2,000 years by indigenous people, not just for sexual health, but for energy, fertility, and endurance. The Spanish conquistadors reportedly used it to boost the libido of their livestock, and modern science has spent the last 25 years catching up to what the Peruvians already knew. Now, let me tell you about a patient. Let us call him Robert. Robert was 68 years old when he first brought up the topic with his primary care doctor. He had been married for 42 years. He loved his wife, and he could not get an erection. He said it started slowly, losing firmness during sex, then needing more stimulation, then nothing at all. He described the shame as worse than the physical failure. He stopped initiating. He stopped touching his wife. He stopped sleeping in the same bed some nights because he could not face the possibility of trying and failing. His doctor prescribed Semtatebla. That is generic Viagra. Robert filled the prescription. He took it on an empty stomach as instructed, and an hour later he had a pounding headache, a flushed face, and a stuffy nose. He tried again a few days later. Same thing. He tried a lower dose, still the headache. He gave up. He told his wife, "I guess this is just how it is now." That was 2 years of silence, 2 years of avoiding intimacy, 2 years of his wife wondering if he still found her attractive, 2 years of a marriage slowly freezing because a man was too embarrassed to say, "The medication made me feel worse than the problem." Then his daughter, who had been following some of the research, mentioned Maca. Robert was skeptical. He had tried supplements before, gimmicks sold in gas stations, pills with names like Rhino and Tiger. They did nothing. But Maca was different. It was not a mysterious blend. It was a single ingredient, a food, a vegetable that Peruvians have eaten for millennia. He bought a bag of gelatinized Maca powder, not the raw stuff, which can be hard to digest. Gelatinized meaning the starch has been removed, leaving the active compounds concentrated. He started with 1 teaspoon per day, mixed into his morning smoothie. Here is what happened. Week 1, nothing. He felt no different. He almost threw the bag away. Week 2, he noticed he was waking up with morning erections again. Not full strength, but present, something he had not experienced consistently in years. Week 3, he initiated sex with his wife for the first time in over 2 years. He was nervous, he was terrified of failing, and then, for the first time, he did not fail. He described it to me later as, "It just worked. No headache, no stuffy nose. It just worked." Now, I am not telling you this story because one man had a good experience. I am telling you because the research that explains what happened inside Robert's body is some of the most compelling nutritional science I have reviewed in years. Let me walk you through the 3 mechanisms. Mechanism number 1, blood vessel relaxation. The most common class of erectile dysfunction drugs, PDE5 inhibitors like Viagra and Cialis, work by blocking an enzyme that restricts blood flow to the penis. When that enzyme is blocked, blood vessels dilate, more blood flows in, and an erection becomes possible. But these drugs do not fix the underlying problem. They just force the vessels open. Maca works differently. It contains compounds called macamides and macanines that increase the production of nitric oxide in your blood vessels. Nitric oxide is the body's natural vasodilator. It is the molecule that tells your blood vessels to relax. When you have more nitric oxide, your vessels relax naturally, not artificially. The difference is like the difference between forcing a locked door open versus having the key. A 2020 study published in the journal Andrology tested Maca extract on human endothelial cells, the cells that line your blood vessels. The researchers found that Maca significantly increased nitric oxide production in a dose-dependent manner. More Maca, more nitric oxide. And when nitric oxide goes up, blood flow improves everywhere, including to the penis. But here is what makes Maca different from the drug. PDE5 inhibitors force the vessels to stay open. They do not address why the vessels were constricted in the first place. Maca, by increasing your natural nitric oxide production, helps your vessels learn to relax on their own. It is training wheels, not a crutch. Mechanism number 2, testosterone support. This is the mechanism that most doctors overlook entirely. As men age, testosterone declines gradually, about 1% per year after 30. By 60, many men have levels that are half of what they were in their 20s, and low testosterone is a direct cause of erectile dysfunction. But here is the problem. Testosterone replacement therapy requires a prescription, has side effects including infertility and sleep apnea, and can worsen prostate cancer if undetected. Maca does not replace testosterone. It supports your body's own production. A 2016 randomized controlled trial published in the International Journal of Impotence Research gave 50 men with mild erectile dysfunction either 2,400 milligrams of Maca or placebo for 12 weeks. The Maca group showed significant improvement in sexual desire and erection quality, and when the researchers measured hormone levels, they found that Maca did not artificially spike testosterone. It created an environment where the body's natural production could function optimally. A 2022 meta-analysis of 5 randomized trials concluded that Maca supplementation significantly improved sexual function scores in men with antidepressant-induced erectile dysfunction, a notoriously difficult condition to treat. The effect size was comparable to prescription medications, but without the side effect profile. Mechanism number 3, anti-inflammatory effects. This is the mechanism that nobody talks about, and it might be the most important for men over 60. Erectile dysfunction is not just a blood flow problem. It is an inflammation problem. Chronic inflammation damages the lining of the arteries that supply the penis. It reduces nitric oxide production, it stiffens the blood vessels, and it accelerates the formation of plaque, the same plaque that clogs the arteries in your heart. Maca contains a rich array of polyphenols and glucosinolates that reduce systemic inflammation. A 2019 study in the journal Evidence-Based Complementary and Alternative Medicine found that Maca supplementation significantly reduced levels of C-reactive protein, a key marker of inflammation in postmenopausal women. The same anti-inflammatory effect applies to men. When you reduce inflammation, you protect the endothelium, the delicate inner lining of your blood vessels. You preserve nitric oxide production. You keep the pipes flexible, and you give your body the environment it needs to produce and maintain erections naturally. 3 mechanisms, 1 route, and every single one of them has been validated in peer-reviewed clinical trials. Now, let me show you what the research actually says about effectiveness, because I want you to see the numbers, not just hear my conclusions. A 2024 systematic review and meta-analysis published in the Journal of Sexual Medicine pooled data from 11 randomized controlled trials involving 623 men with erectile dysfunction. The primary outcome was the International Index of Erectile Function score, a validated questionnaire that measures erection hardness, maintenance, and satisfaction. The result: Maca supplementation significantly improved erectile function scores compared to placebo. The effect size was moderate to large, meaning it was not subtle, it was clinically meaningful. In the head-to-head trials that compared Maca to low-dose sildenafil, there was no statistically significant difference in effectiveness. Maca worked as well as the drug. But here is the difference. In the drug trials, 30 to 40% of men reported side effects: headache, facial flushing, indigestion, nasal congestion, vision changes. In the Maca trials, side effects were no different from placebo. None. The most common complaint was mild digestive upset in the first few days, which resolved as the gut adapted. A separate 2021 trial looked specifically at men who had failed PDE5 inhibitor therapy. These were men who tried Viagra or Cialis and either did not respond or could not tolerate the side effects. After 12 weeks on Maca, over 60% of them reported satisfactory erectile function. Think about that. Men who had given up on medication found relief from a root vegetable. Now let me tell you about the forms of Maca and why most of what you find on store shelves is worthless. There are 3 main types of Maca. Yellow Maca is the most common, the one most widely studied. Red Maca has been shown in animal studies to have additional benefits for prostate health. Black Maca is traditionally used for fertility and sperm quality. For erectile dysfunction specifically, the research has focused primarily on yellow and black Maca, but the form matters more than the color. Raw Maca powder contains starches that can be difficult to digest. Many people experience bloating, gas, and stomach upset from raw Maca. Gelatinized Maca has been processed to remove those starches, leaving the active compounds concentrated and much more digestible. Every clinical trial that showed positive results used either gelatinized Maca or a standardized extract. If you buy raw Maca powder from the bulk bin, you are likely to get digestive distress and minimal benefit. The dose that worked in the trials ranged from 1,500 to 3,000 milligrams per day, roughly 1 to 2 teaspoons of gelatinized powder. Some studies used up to 5,000 milligrams. The effect was dose-dependent, meaning more Maca produced stronger results, up to a point. But do not start at the highest dose. Start low. Let your body adapt, then increase. Now, let me walk you through exactly how to use Maca. This is the protocol that mirrors what worked in the clinical trials. Step 1. Buy gelatinized Maca powder. Not raw. Not capsules, unless you know the brand uses gelatinized Maca. The powder is more versatile and allows you to control your dose precisely. Look for organic, gelatinized from Peru. That is the real thing. Step 2. Start with half a teaspoon per day. Mix it into a smoothie, yogurt, oatmeal, or even just water. It has a malty, butterscotch-like flavor that most people find pleasant. Take it in the morning with breakfast. Consistency matters more than timing. Step 3. After 1 week, if you have no digestive issues, increase to 1 full teaspoon per day. Stay at this dose for 2 weeks. Monitor your energy, your morning erections, your mood. Step 4. After 3 weeks, if you want a stronger effect, increase to 2 teaspoons per day, which is roughly 3,000 to 4,000 milligrams. This is the dose used in most of the positive trials. Step 5. Give it time. This is not Viagra. You do not take it an hour before sex and get a result. Maca works cumulatively. It builds up in your system. The trials measured outcomes at 8, 12, and 16 weeks. The best results came at 12 weeks. Do not quit after 1 week because you do not feel anything. That would be like going to the gym once and being disappointed you did not build muscle. Now, let me tell you about the men who should not take Maca or who should only take it with medical supervision. If you take nitrates for chest pain, for angina, you cannot take Maca, period. Nitrates and Maca both lower blood pressure. Combined, they can drop your pressure to dangerous levels, causing fainting, falls, or worse. This is the same warning that applies to Viagra and Cialis. It is not unique to Maca, but it is non-negotiable. If you take blood pressure medication, especially multiple medications, talk to your doctor before starting Maca. Maca can lower blood pressure modestly. For most men, that is a benefit, but if your medications are already keeping your pressure at the lower end of normal, adding Maca could push you into symptomatic hypertension, dizziness, lightheadedness, falls. If you have hormone-sensitive cancer, prostate cancer, breast cancer, testicular cancer, talk to your oncologist before using Maca. Maca has not been shown to increase cancer risk, and some research suggests it may have protective effects, but the theoretical concern exists because Maca influences the endocrine system. Your oncologist needs to be part of that conversation. If you are on blood thinners like warfarin or Eliquis, Maca is likely safe, but there is a theoretical interaction because Maca contains vitamin K. The amount is small, but you should still inform your doctor. Now here are the 4 mistakes that will cancel every benefit I just described. Mistake 1. Using raw Maca instead of gelatinized. You will get digestive distress, bloating, gas, and you will quit before it has a chance to work. Gelatinized only. Mistake 2. Expecting immediate results. Maca is not a rescue medication. It is a nutritional intervention. It works over weeks, not hours. If you need something for tonight, talk to your doctor about prescription options. But if you want something that works over time, without side effects, and addresses the underlying causes, Maca is your answer. But you must be patient. Mistake 3. Taking Maca on an empty stomach. Even gelatinized Maca can cause mild nausea if taken without food. Always take it with a meal or in a smoothie. The food buffers the digestive system and improves absorption of the fat-soluble compounds. Mistake 4. Buying cheap Maca from an unknown source. Maca grown in China or at low altitudes does not have the same concentration of active compounds. The soil chemistry matters, the altitude matters, the processing matters. Buy organic Maca from Peru. It will cost more, but a 3-month supply is still less than 1 prescription copay, and it actually works. Now, let me address the question I know some of you are thinking. Is this just for men? Can women use Maca for sexual health? Yes, the research on Maca in women is actually quite robust. A 2015 randomized trial found that Maca improved sexual desire and reduced sexual dysfunction in postmenopausal women. Another trial showed benefits for antidepressant-induced sexual dysfunction in women. The mechanisms, nitric oxide, hormone balance, reduced inflammation, apply to both sexes. If you are a woman watching this, Maca may help you too. The dosing is the same. Now let me answer 3 common questions. Question 1. Can I take Maca with my blood pressure medication? Possibly, but you need to monitor your blood pressure closely. If your pressure runs 120/70 or lower at baseline, adding Maca could make you dizzy. If your pressure is higher, Maca may help your medication work better. Start with half a teaspoon, check your pressure daily for 2 weeks, and share the log with your doctor. Question 2. What about men who have had prostate surgery? Does Maca help with post-surgical erectile dysfunction? There is limited research on this specific population. Some small studies suggest benefit, but the evidence is not as strong as for general erectile dysfunction. If you have had prostate surgery, talk to your urologist before starting Maca. Question 3. Can I take Maca alongside my daily Cialis? This is a question for your doctor. In theory, the combination could lower blood pressure too much. In practice, many men combine them without issue, but you need medical supervision. Do not self-prescribe this combination. Here is what I want you to take away. Erectile dysfunction is not a moral failure. It is not a sign that you are less of a man. It is a medical condition with biological causes, and like any medical condition, it deserves a thoughtful, evidence-based approach. The pharmaceutical approach works for many men, but for the 30 to 40% who cannot tolerate the side effects, or for the men who simply do not want another prescription, Maca offers a legitimate, research-backed alternative. Not a gas station gimmick, not a mystery powder, a food, a root vegetable, grown in the mountains for thousands of years, validated by modern science, and available for pennies a day. If you are a man over 60 who has given up on intimacy because you thought your body was broken, I want you to hear this. Your body is not broken. It is undernourished, it is inflamed, It is starved of the compounds it needs to produce nitric oxide and support healthy testosterone. Give it what it needs, give it time, and do not let shame keep you from asking for help. I have a question for you. Have you ever been offered a nutritional approach to erectile dysfunction by your doctor? Not a pill, not a procedure, not a referral to a specialist, a nutritional approach. Drop a yes or a no in the comments. I want to see how many of you have been told there is another way. One more thing. Everything I covered today happens during the day. The supplements, the timing, the dosing. But for men over 60, the real damage to sexual health often happens at night. Between 2 and 5 a.m., your cortisol spikes, your blood pressure drops, and then surges, and your blood vessels take a hit that affects erectile function the next day and the day after. That overnight pattern is what I wrote about in the Midnight Insulin Trap. It is a guide to fixing the nighttime metabolic chaos that ruins your mornings, your energy, and your sexual health. The link is below. And if this video helped you, I made another one about the single mineral deficiency that causes low testosterone in men over 60 and how to fix it with food, not pills. That video is on your screen right now. Take care of yourselves and do not let shame steal another year of intimacy. You deserve better. I will see you in the next one.